Today I'm going to address Tasha K's neck mass. Tasha K has just come from her doctor and she says she has been diagnosed with a goiter, polycystic, and that he is going to follow it. She may need surgery in the future, but we all hope she doesn't and that it can be taken care of with medication. Sometimes people do need surgery, and the good thing is those surgeries are usually successful if you have a skilled doctor. Just make sure he's done a lot of thyroid surgery successfully in the past, and most people will not suffer any vocal cord damage. The bigger the mass is, of course, there can be more and more entanglements, so you do want to take care of it sooner rather than later, but surgery is always a big step and must be closely considered, especially when your job is talking. So we wish you well, Tasha, and we hope that you don't need surgery and that you are able to take care of this with medication and by visiting a great endocrinologist. When I was little, it was common to see people with large neck masses. Those masses were much bigger than Tasha's, very, very big. And as a child, I didn't understand what was going on. Why were these people having this problem? My mother didn't explain it well, but over the years I found out that this was a goiter, and even later I found out that it had to do with diet, iodine in fact, and that most Americans don't get goiters now because we have iodine in our salt, iodinized salt. Tasha says she had some indications when she was a child that she had something wrong, but it was never investigated. I would have been very concerned if I did not go to the bathroom for a month. I want you to put a month's worth of food on your dining room table, whatever you thought you might eat over a month, and just look at that mess. How in the world can you have all of that mess in your intestines and not in any way feel the urge to go to the bathroom? I feel very sorry for Tasha. I have compassion for her, and I hope that that problem has resolved. And I suggest that she also see a gastroenterologist and have her colon evaluated, because her colon must have been massively stretched in order to hold that much food and not have the urge to poop. One reason God gave us animals is because many people are, well, I'll just say it, too stupid to know how often they have to go to the bathroom. It's one of the most commonly asked questions. How many times does a person have to go to the bathroom? Well, that's why God gave us cats and dogs and birds. That's why we have zoos. That's why we have animals in the jungle. Anywhere you go, you see that animals in nature go to the bathroom once a day, and that animals in nature pee multiple times a day. They're not peeing all day. They're able to hold their urine and then they go to the bathroom. So we know that when we have problems going to the bathroom, or if we're having problems with our urine, those are abnormal, and those are times we need to see a doctor. Unfortunately, Tasha did not get this care, and thanks heavens we have medical insurance as initiated by Barack Obama when he was president. I'm going to go over some of the things Tasha talked about because I think the way she presented her problem and causes and so forth was a little bit confusing, and I think the average person might have some problems figuring out exactly what's going on and how to diagnose this problem if they have it too. As I said, it can be very common. Well, I know Tasha doesn't like to talk about her health problem, but the thing is, Tasha, by her job, has felt it was okay to talk about Cardi B and what was in her underpants, and she felt it was okay to talk about Wendy Williams and her mental problems and her physical problems, and so on and so forth. I've only watched Tasha over a month, and so I don't know what topics she's actually covered in the past. But from what I see of Tasha, I think she's covered a lot, and so I think she would want her fans to know exactly what's going on with her, too. We wouldn't want her to be a victim of gossip. So, some of the basics about the thyroid: it's an organ that sits in the middle front of your neck. You can feel it. Just take your hands, your thumb, and your finger, and rub over the front of your neck. A lot of times you can't feel your thyroid, and if you can, you'll feel a mass that usually is on both sides, the left and right side of your esophagus, and both sides feel the same. If one side's bigger than the other, that means it's enlarged, and that's usually benign, but it is a reason to go to your doctor and have it checked out. Tasha's thyroid is enlarged mainly on her left side, and that's easy to see from her pictures. Tasha says her thyroid will go up and down in size, and that sometimes it bothers her and sometimes it doesn't. So, what is really important, not only the size and how it appears, but there are lots and lots of other effects, and the thyroid is a required organ. In other words, without your thyroid and its hormones, you're going to die. So you do want to make sure that your thyroid is taken care of. Tasha mentioned she might need to have surgery. Well, we hope that Tasha doesn't need surgery, but the good news is that most thyroid surgeries go well and you don't lose your voice. However, you do want an experienced surgeon who's done a lot of thyroid surgery successfully, and you might discuss that with your doctor, and also you might even want to talk with some of his past patients just to feel more comfortable and decrease your anxiety. A lot of thyroid problems can be taken care of just with medication, and you don't have to go to surgery. And we certainly hope this will be the case. But taking thyroid medicine, if you have to, is important to take it regularly. Sometimes it can be overprescribed or underprescribed, and so you do have to get your thyroid levels checked regularly, and you just can't ignore it by popping a pill. Your thyroid is going to affect your appearance, of course, and it's also going to affect your heart rate. People who have hyperactive thyroids producing too much hormone will find that their heart beats faster. In addition to a fast heartbeat, they'll also sweat more, and they'll feel anxious, nervous. They may breathe faster. That can be because of the heart rate, or it can be just because of the thyroid. And there are many, many other functions, as Tasha addressed, including constipation, which can be recognized as a sign that you need to get your thyroid checked. Most people are very attuned to their weight, and they find that if their thyroid is producing too much hormone or if it's underactive, they will notice weight changes. A thyroid that's hyperactive too much will cause weight loss, and a thyroid that's hypoactive, too little hormone, will cause you to gain weight. So these are something that people will see that might cause them to decide to go to a doctor. So it's not just diet that you have to do if you're losing or gaining weight. You have to have a thorough examination, and you also have to have your thyroid checked. I am offering preventive medical lab diagnoses for endocrine problems and other health problems. And if you want to contact me about getting this online and done by a reliable lab in your area, just email me at med911911 at outlook.com, and I will get back to you and discuss what types of laboratory preventive medicine evaluations you might like to have personally. Another thing that Tasha didn't mention that she might notice is that Tasha has what I call droopy eyelids. Her eyelids do not open to a normal amount, and her eyes kind of have a droopy look. That is also a sign of a thyroid disorder and needs to be evaluated. The tissue behind the eyes or in the eyelids can swell, and that can cause a droopy, sleepy type of look. I noticed that on Tasha, and that is something that she will find, hopefully, will resolve as she goes along her treatment path for her hot thyroid disorder. Tasha mentioned her skin. She says she always gets compliments on her beautiful skin. Thyroid disorders will definitely cause changes in your skin. Your skin can become dry, pale, and cool, and that would be mostly if you're hypothyroid, or it might become moist, velvety, and warm, like a baby's. Dry skin can cause cracking and scaling, flaking. Sometimes you can get creases in the palms of your hands and the soles of your feet, and those would be diagnosed mostly by a doctor. Skin can become puffy, so that in the legs it's possible to notice water retention, and that you can take your finger, poke the leg, and leave a dent in the leg, and that is because of water retention. A doughy look in your face, eyelids, lips, or tongue can also be signs of a thyroid disorder. Even a widening of your nose. Now, nose changes can happen with aging. So just because you're having nose changes doesn't mean that it's a thyroid disorder, but it is one of many things you might notice, along with other things that might indicate that you have to have your thyroid checked. If you're not healing properly, so you get a cut or you're coming from surgery and you notice you're not healing properly, that can also be a sign of a thyroid disorder. If you're sweating less, so that you're doing something that normally would make people sweat, or you're sweating less than you used to, that could be a sign of a thyroid disorder. Of course, the opposite, you're sweating too much, you're sweating more than most people, and of course you would have the heart racing and so forth. That can also be a sign of a thyroid disorder, and that should be checked out. Protruding eyes is something that most people recognize as a sign of a thyroid disorder, and that can happen with either too much thyroid hormone in the body or too little. They're different disorders, but they're both of the same gland, and the difference has to be diagnosed by a doctor. The protruding eyes often don't resolve, and once they protrude, a lot of times that does not go away. It can lead to problems such as dry eyes, itchy eyes, and even can cause ulcers on the eye if the eyes become too dry. This is especially true if your eyes are protruding and when you sleep, your eyelids don't close all the way, so that you're sleeping and spending most of the night with your eye exposed, not covered by the eyelid. The eyelid keeps the eye moist and healthy. So if the eyelid is not closing at night while you're sleeping with your eyes partially open, you can get sores on the eye, and that can lead, of course, to different kinds of problems. Luckily, with the cameras we have, a lot of people can take pictures of themselves sleeping and notice themselves whether or not they sleep with their eyes open. It can also cause scratching. If your eyes are partially open and you have a scratchy pillow or it touches something, that can cause an injury to your eyes while you're sleeping and you won't even know why that occurred. You can get flushing. If you're hyperthyroid, you can flush in your face, in your palms, in your neck, and that would be evidence that you need to have a physical examination. Other things can cause flushing, but thyroid would be among the things that might cause that problem. Thyroid disorders also cause a change in skin color. It can make you paler or it can make you darker, depending on the disorder. You can also have itchy skin and or rashes. So those are things that also should be listed as a symptom that should be evaluated by your doctor. So those are some of the skin things you might think of and want to check out if you think you have something going on. I'm not diagnosing or saying anything about Wendy Williams, but we all saw how big Wendy's legs became. They were swollen, big, and hard. But she probably also had lumpiness in her legs. And as your legs swell, they tend to feel dry and sort of waxy. And we all saw on the Wendy show how discolored her legs were around her ankles. And those are all signs of thyroid disease and should be evaluated. So I don't know whether Wendy's leg problems were caused by her thyroid, but that would be one possible thing to evaluate by her doctor. Other things that the thyroid can do is cause changes in your hair and nails. People with thyroid disorders often have thinning eyebrows. They may have no eyebrows at all, especially on the outer edge. That is a sign of possible thyroid disorder. The hair can be coarse, dry, it can be brittle, it can break easily, it can be short because of breakage, and you can have scalp disorders, which dry, itchy, flaking scalp. You can have balding of the scalp from thyroid disorders. Sometimes the hair might even be soft but very, very fine and break off and shed for being hypothyroid. These things must be evaluated, distinguished, and coordinated with laboratory results in order to decide what your problem individually is. None of these things can be taken separately, and none of these things should be diagnosed totally without having the blood test. As I said, I am offering blood tests, and you can contact me at med911 at outlook.com by email if you want to have yourself evaluated in a preventive way to see what may or may not be going on with your body if you have any complaints like this that you relate to. Nails are another way that you can indicate what's going on with your body. Now, when people studied thyroid in the past, people weren't doing so much to their nails. Now people are having regular nail appointments, and a lot of times they are getting infections by the person who's doing their nails. And so a lot of the things that we normally associate as indicators of thyroid disease might also be related to problems with your nail salon. But normally, the things we look for in nails, they can be thick, dry, brittle, and you can have ridges visible on your nails. Your nails can also be soft, pliable, shiny, and crumbly. That would be another sign. They can grow very slowly, or they might grow very quickly. Your nails may break easily, or the tip of your nail might lift up so that it doesn't have space between the nail and the finger pad. That would be something that would also be evaluated. Or the nail could be curved down and you could have a swollen fingertip. So the nail could be curved up or the nail could be curved down. Again, you can't tell just by one thing. And the fingernail bed might be a little swollen. The one thing that is often seen too is itchy skin, and it doesn't get treated by normal anti-itch medications. In other words, you're still itching after you've done things you would normally do to resolve your itch. Okay, well, I have a lot more things to say, but I just want to put these out. I'm really loading this on you, and we'll talk about it all later in my next video. Remember, you can contact me if you have any concerns about your own health and want to take preventive care to make sure you're not having a problem that's undiagnosed, or if you don't want to be in the confines of a medical office, you can contact me by email at med911911 at outlook.com. That's med911911 at outlook.com. And we can discuss what issues you're having and what kinds of lab tests you would like to have at your local lab in order to be evaluated for your concerns. Please like and subscribe.